Renee
Is there
Farmer.
anyone else? Hey, Renee Farmer, thank you. Anyone else who's phone in only or cannot log into that form? All right. Well, we're good, making good time. We're already 5 minutes ahead of time. Is there anyone else? If not, I'm just going to open that floor up to the open forum, number one. Again, we're not here to necessarily solve the problem right this time, but definitely open it up to pretty much anything and regarding where we want to talk about it and maybe even at a future agenda. So the floor is open. Just give us your name and we'll put your name in the queue and we'll move forward.
Renee.
Thank you, Renee. Anyone else? Okay, Renee, let's go ahead.
Yeah, I did not receive any documents for this meeting in the mail. Is there a reason for that?
Aaron, maybe, or Jessica, could you help me with that? Or
Yeah,
Danielle?
I can jump in. This is Jessica. We are using our HICPUF mailing services for the mailing at this point. We did put in the request in advance of the meeting and with enough time. So let me double check with our staff who coordinate that and make sure the process is understood by everybody. Apologies to you, Renee, and to anyone else who didn't get those materials. We will definitely send them out just as soon as we can after the meeting.
Okay, thank you. And I have one more question. Is there a reason that I couldn't find the meeting from last month posted online?
I do believe that it took a few more days to get it up, but as of last week, I was told that it was posted. So we'll double check that again and also look at that process to make sure it's posted as soon as possible after the meeting.
Thanks.
Okay.
Thanks a lot.
Robin, I see you have your hand raised.
Oops. Oh, there he is.
Hey, Robin.
So yeah, all I could find was this thumbs up. I don't know why. I finally found it. I had a couple of questions. One is what I'm hearing pretty consistently from folks is that the case management agencies are telling folks that it takes 6 months to get CDASS up and running, but they can go immediately onto into an agency. So people are going into agencies even though that's not what they wanted. So why? I mean, I've been able to get people up and running in CDASS in 30 days. It's usually a bit of a struggle. So why would it be taking so much longer? And how can we fix this? To me, we need to even the playing field that that we can get CDASS and agency care up and running and people get to choose, not be pushed into an agency, especially when we have agencies. I've got somebody who's stuck in a nursing home because they can't find an agency, and then and we're pushing CDASS and we're being told it's going to take months and months. It just doesn't make sense to me, because isn't it a similar process? Why would one take 6 months longer than the other? So that's I guess it's a question and a comment, and I don't know if it can be answered now or maybe it's a discussion for another day. So that's that one. The second issue that's come up is I've got a parent who's on IHSS, and the IHSS agency is telling her they won't provide services to her daughter unless she provides a backup to her backup or something. And who would I send that to? I don't think that's a discussion for today. I'm just not sure who I should send the email to.
Robin, it's Erin. Please send it to me. I would love to help with this one.
I know, it was like bizarre. Okay,
I mean, we
thank you.
definitely need backup care, but thank you. And just to touch on like the estimated time for CDASS, I think it really depends on the individual and the situation. Like personally, I've seen somebody get on CDASS like from enrollment to starting within 5 days. I've also seen it take 2 years. So I think it's an estimate is really hard in this scenario, and it really depends on how motivated and organized people are. But I think we can definitely work on this and work on some messaging. And thank you for sharing. I really appreciate it.
Yeah, because this was, I mean, these are folks that, at this point, when someone wants to leave a facility or they need services right away, I download all the case management forms, and we've got the case management forms up and ready to go before they even do intake. And then they're still being told it's going to take 6 months. And it's like, and like you said, I've seen 5 days, my own daughter, 5 days. And I've also seen 2 years, and where that came from. So you definitely get those. Okay, well, thank you. Those were my 2 questions.
Okay, Danny, I see you have your hand raised.
Yeah, I just wanted to add to Erin's response too, and just provide some clarification in case anybody is interested in agency-based care. But because of the nature of CDASS, it can take some time. And I think like just standard process, I think the minimum that we would expect somebody to be enrolled is right around 20 to 21 days, just with all of the processes involved. And that's if somebody's incredibly motivated. And we really do want people discharging from nursing facilities. And that's why we do encourage members to try to set up agency-based care in the interim while they're in the process of enrolling for CDASS, because we do want to make sure that they can get home. Obviously, sometimes that's not an option, and we do work hand in hand with many individuals to expedite CDASS enrollment. So, Robin, I hear you. We do need to work on improving it. We need to quicken the process. And to Erin's point, some of it is, it is self-directed, so sometimes can take a little bit longer. But in the interim, until we have a better process in place, we are happy to assist people on a case-by-case basis to get those enrollments processed quickly.
Yeah, and I think it's definitely messaging too, because, I tell people about CDASS and then they reach the SEP and they're told that takes 6 months to a year. And as you're saying, not necessarily, but honestly, I've had to argue with SEPs and say, no, I know you can do it in 30 days. I usually say 30 days. So it becomes an argument, and then you get the referral. So.
Well, thank you. If you want to add this as a discussion topic too, we can definitely have some more thorough dialogue probably in another meeting if you want to add it as a topic.
Yeah, Kurt, can you do that? Because I think I would like to analyze what's taking so long and why versus the agency model. So why can an agency be up and running in a day or two and CDASS takes even 30 days or 6 months or 2 years? What's getting in the way of, and the folks that I'm working with, they've got their, they've identified attendance, they've got their paperwork ready to go. It's just, usually they're waiting for the county eligibility. So it's like, what's getting in the way? And, and we need to work on that. This can happen in 30 days, and case managers need to know that. And, and when somebody asks for it, they need to give good information. Right. So if we could put that on a topic, that would be great. Thanks.
I agree, Robin. I just said add CDASS timeline as in the notes, just as a reminder, so we can add that to agenda. I think if we could kind of lay out a timeline, that'd be a nice thing for people to know as far as what's expected. And again, I know
including the case managers. I don't think the case managers
to a year or longer. So maybe we can do that. Is anyone here with Consumer Direct? Is Adam online or Joe or anyone by chance? Because I do know we do have a people can ask for an expedited. Hey Adam, yeah. Don't we have like an expedited or service that we try to do when we know about it?
Oh, sure. Yeah, when I get ones they don't even need to be specifically expedited. When I hear that people have been going through a process that was outside of their control, I kick stuff through pretty quick. So I guess there's 2 different questions going on here, or parts of enrollment. Is it enrollment onto the program and waiver, or is it they're talking about their entire enrollment process, which has the training in there, and then the FMS enrollment, and blah blah blah. So we pride ourselves on trying to make sure it doesn't get held up on the training end.
I've
Yeah, I
never heard of it being held up on the training end, Adam. I thank you. That's
Oh,
never
good,
the
good.
issue.
Let's get
Right.
and let's customer service, or somebody I spoke with this morning is where, in an attempt to be quick, they've skipped processes. Like, let's just jump right to Palco, and I'm like, oh no, let's come backwards and kind of get the wheel spinning right.
Yeah.
So I'll help them out and things like that. And
Yeah, what I'm hearing on the training end is the case manager saying, I can't refer to training until I do all of these other things. And it's like, no, the person's qualified for the EBD waiver. They want CDASS, you refer them for training. But and then I get, well, that's our policy. It's like, well, then change your policy.
well, yeah, I don't know about
Yeah.
that. Like, I've been happy to help people who are on their way towards a waiver, when they turn 18 or something, and we will close some steps as they get to there. So maybe there is a miscommunication with what.
Yeah, and two of the people are folks on Medicaid who are now applying for long-term care. So they've already qualified for Medicaid. And then I'm being told, and it's the same SEP, so we can talk about that. But, they're not allowed to refer to you until the task worksheet is completed and all this kind of stuff. And it's like, no, I don't believe that's true. What?
This is Delane, and I'm with
Let's
Powers
keep
County
that-
Public Health. Hello. I'm
Yeah.
we're case managers, and there is a lot to CDASS from the beginning to the end. And from the beginning, as they're already on Medicaid, and we go through that part, they do have to do the training, and that is part of that. But we also have to work with Telegen. We have to get all of that in, and it does take a while, and it is a lot of work. And I really kind of take it back when you're blaming the case managers when we're going through a CCM system that isn't working, and trying to get the CCM system and Telegen to talk to each other, and then to have to go through PPL or Palco and make sure that all's all working together. When they're carrying, 70 and 80 other clients, and they're getting them done too, and then the PAR's not going through. It is a lot. There's a lot going on right now. So maybe give your case managers a little bit of slack. You can help them by getting the paperwork that is needed to be given to Telegen. That's where we get our biggest problem, is trying to get stuff through Telegen. But I kind of take it back a little bit on the case management, because I think they work really hard and they really try hard.
I absolutely agree.
And I just want to add that I know there's a lot of steps in the process, and we do understand it is a self-directed program. So there's a little bit of ownership that has to be put on the people who are trying to get on it as well. So we can apprioate that.
And that's
think
why
let's
I
just
want to
add that
discuss
right onto the
it.
agenda.
Yeah, that's Kurt. That's why I want to discuss it. That part of the problem is we've put way too much on case managers. So I am not dissing case managers. They need to have good information so they can move it forward. It's not the case managers, it's the system. So we need to create a system that's more equitable so people can choose consumer direction.
Yeah, definitely have to look at streamlining that process somehow. So, well, great conversation, everyone. Great. Adam, I see you got your hand raised up. One more thing before we get on to the next step here. What's up, Adam?
Final piece, I will just say the collaboration that's been going on with case managers and us has been stellar in these past couple months. Like, there's been contact and clarification and quick emails and responsiveness, even though they're so busy. Like, we've noticed a giant positive collaborative work with case managers, kind of doing everything they can to smooth it up and us to get it to. And so it's been pretty great.
Yeah, I've been hearing that too, Adam. Appreciate that. There's a lot of good stuff happening, with a lot of moving parts happening with changes in the state regarding SEP agencies and developmental pathways. So a lot of good stuff happening, and hopefully it moves forward and we smooth it out for people, and hopefully we can discuss that process a little bit more on the next agenda. All right. One last thing here. It is about 1:20. We're right on time with everything, but got a little bit of time, I think, today. So any other comments? If not, we do have a second open forum here a little bit later. If not, I guess I am next up on co-chair applicant presentations. I did receive 3 different applications. We did ask that they were closed by the 15th of this month. So I do have 3, and I'm hoping I have everyone here today. I did not reach out to each individual, but what I could do is say if anyone is on who's applied, and let me just bring the names up here that I have. Bear with me here. I gotta look them up where I have them saved in my emails here. So I'll just say thank you for everyone who did apply. Really, this is our program here. This is not run by the state. This is us as participants in running this. We had a lot of feedback the last few months. I know there's a few people who have not been really involved here just recently, more because I think that there's a lot going on with the state legislature right now. So I'm trying to find my, sorry, I don't mean to be pausing here. I'm trying to dig up my emails that I saved for everyone's applications. One that I do know right off the top of my head is for Michelle. I'm wondering if it would be smart. Let's have everyone maybe give a little introduction if you're applying for the co-chair's job. Think about it a little bit, and I think the next step after this will be figuring out how we want to proceed with voting and accepting those nominations. So Michelle, if you're on, I'd love it if you could talk first a little bit about yourself.
Thank you, Kurt. Way to throw me right into the spotlight. I wasn't prepared for this.
Sorry, I know you're up to it. I know you're
That's
up to
okay.
it.
We're all about fly by the seat of our pants. So for those of you who don't know, my name is Michelle Morris. I have been in the healthcare industry for well over 20 years with varying different capacities. Everything from medical records, financial counseling, case management, as well as caregiver for my son, who is now a teenager. My passion right now is supporting those complex children, medically fragile children. So I've brought forth a lot more information, insight into IHSS and the pediatric population. I transitioned to case management back in 2017 and started a special needs connection, which is currently a private case management agency. We are going to be changing some things. So I'm excited for our next step to be able to really be a voice and an advocate for the pediatric population that is accessing IHSS, and then next year also accessing CDASS. My dedication, I would say, is advocacy, continuous education. Adam, I appreciate your energy. Anytime you're doing a webinar or speaking on here, you make training very bearable, which is always great. I'm also excited to see that IHSS and CDASS will be a mandatory training for case management. I think there's a disconnect there and a lot of unawareness with case management, which is going to be key with the changes that are coming. I would say as co-chair, as I mentioned, I really want to bring a perspective from pediatrics. I know that the PDPPC has been around for a very long time and is primarily CDASS focused, hence why it's for adults. But as we start to see these changes coming up we have IHSS more utilization and then CDASS being utilized by the pediatric population, I think that both age ranges should be well represented within the PDPPC for families, for policy change, for overall suggestions and conversation. The experience that I'm bringing to the table, I have experience, as I kind of mentioned, working in a leadership role. I currently own a special needs connection. Like I said, we manage about 400 kids statewide. I also do all of our community training. So I provide the training for hospitals, social workers, physicians' offices, educators, things like that. So being in that organized leadership role is something that I'm very familiar with and feel very comfortable with. Gosh, I'm not really sure what else to say. Like I said, I wasn't really prepared for this. So I think that's my bio. That's my input as to what I'm bringing to the table, what I would make a priority, and why I think I would be a good co-chair.
Awesome. Well, thank you there, Michelle. So yeah, I was just going to try to throw you right out there into the wolves there, but well, anyone has any questions, please raise your hand. And I see we already have Jerry has raised her hand. So Jerry, what have you got?
Yes, my question for Michelle is, what adult waivers is she most familiar with?
I would say at this point, the adult waivers, my specialty is in children's waivers, but as far as adult waivers, my familiarity is most with EBD. We currently case manage the children's HCDASS waiver. And so we have a lot of our families, when they're transitioning from children to adult waivers, a majority of them are transitioning over to EBD.
Okay. Okay, Jerry, does anyone else have any questions for Michelle? Anyone else?
I apologize, I wasn't prepared for this, but I think one of the most important things I forgot to even throw out there is that I'm obviously, I'm an IHSS parent for my son. He's been on IHSS for, gosh, probably 7 years. So longer than it's been. I know there was a huge breakout of IHSS 2020, 2021. So being from the parent perspective as well as a provider perspective, I can hear both sides. But for this particular committee and collaboration, I think the parent side of me brings a lot to the table.
I'll just throw a question I have out there, Michelle, is regarding IHSS and CDASS, you see those transitions. What are some of the difficulties you see in transitioning people from one service to the other?
So I just want to clarify, because you cut out a little bit. So what do I see as a difficulty of transitioning from IHSS to CDASS?
Some of the difficulties, yes.
I think it's the responsibilities and the administrative part of it. In IHSS, as it's been mentioned plenty of times, agency takes on a huge role. Whether it's the training, the skills check, the policies, the hiring, the firing, they're doing all of that so that that caregiver can focus in. And again, I'm bringing a pediatric perspective, but so that the caregiver can just focus in on that care plan and providing the care. And so I think that there are a fair amount of families that are well versed in that kind of organization for their children. And so I think that they will make the transition from IHSS to CDASS rather smooth. But I do think that there are going to be a number of families that are going to choose to stay with IHSS because they don't have the ability to take on those additional responsibilities.
Okay, good. Anyone else have any other questions for Michelle? I know I kind of threw you right out there. We do have 2 other applications also that we did have, but any other more questions for Michelle? Okay, I know we did have this agenda regarding the applications, so I thought I'd throw, and my apologies, I did not reach out to everyone right up front and say, hey, we're going to have a little presentation here. Well, I'm on it though. I do have another one. I have that name up here. It is, let me bring my page back up here. This is for, let me get out of here. Bobby Christensen, are you here by chance? Hello, Bobby? So, well, what I will do is I'll just take the opportunity, and please, everyone, consider that I did not reach out to people ahead of time. We just had this on the agenda. I want to follow up on this. So I did get a quick bio on Bobby, and I'd like to just share what she had to say. And if you guys are having a hard time hearing me, please interrupt. I know my Bluetooth connects once in a while. It's a little bit sketchy, but I'm going to do my best, right? It says, Dear PDPPC, my parents, twin sisters, and I grew up in a small town in Colorado. I have a certificate in computer applications, a certificate in paralegal studies with an emphasis on disability rights, and 2 years of study in social work and a certification in social work issued by the state of Arizona.
Ron Heller is on the phone.
Okay. Thank you very much. All right. So again, continue on that. Basically, she said she has worked in social field work for about 6 years for the state of Arizona, interviewing clients for food stamps and Medicaid programs, as well as assisting them with this process. Then completing her bachelor's degree in human services at the University of Phoenix online campus. She goes on to say after her divorce and moving back to Colorado, she's chose to go back to school for a career advancement, applied at Regis University to do her master's in nonprofit businesses. While she was in school, she had the opportunity at a local church for a nursery coordinator. So in 2013, she interviewed for the position and was blessed to have that job. Unfortunately, due to budget constraints, that job ended in 2019. At this point, she's contacted the VOC Rehab to start a process for looking for another job. And as of 2020, she's blessed to be hired with the Wonder Years LLC, a job coaching with a specific job duty to write resumes for clients, to highlight their qualifications and help them with choosing an employer despite their challenges. The primary responsibility right now is, as of February 2021, she was asked to be interested in becoming an advisor for SABE. I don't know what that is, but I just thought I'd throw that there. And she jumped at the chance because she was inspired to work with others and helping them achieve their dreams. Always had a heart for working with nonprofits, helping individuals with disabilities, screened in life, no matter what their choices and challenges are. And she feels encouraging when she can see others being empowered by making a small difference in their life. She was born with cerebral palsy. She uses a power mobile wheelchair. Always show people with disability is a gift and show the word that there are many ways to accomplish anything. You just want to look outside the box and find it. Please don't judge a book by its cover. My hobbies are creative writing, reading, horse riding, spending time with my family and friends, and enjoy singing with friends and speaking in public to break down barriers for disabled people as well as the elderly. So that's basically her life experiences on that. I just want to throw that she will be out there for a nomination. And I will share this with everyone as we move forward so we can make an educated vote as well. All right, I see a few people. Go ahead.
Sorry, Kurt, this is Erin. I see Bobby here and I see her raising her hand.
Oh, Bobby. Okay, I didn't know your number. Hey, Bobby, how you doing?
I'm doing great. I just wanted to explain what SABE meant. It means self-advocates becoming empowered, and we train them on skills that they feel will help them be a better self-advocate for themselves and others.
Outstanding. Thank you. Thank you. I've learned something today. I appreciate that.
You're welcome.
Bobby, is there anything else you might want to say on your behalf for this?
The only thing I can think of right now is that I want to make sure that everyone knows that I am very approachable and I am willing to look at all options before we come to a final conclusion on any matter.
Outstanding. Outstanding. All right. Does anyone have any questions for Bobby?
Hey, Kurt, this is Kevin. I just want to let you guys know that
Hey,
I have joined.
Hey, how you doing?
I'm good. I'm good. One thing I would say about this discussion is I think we need to make sure that everybody is describing whether they are applying for the IHSS co-chair or the CDASS or other. Does that make sense?
Good question. So it does, because we are looking at, right now we have two co-chairs, as everyone knows. One is specifically Kevin, is more addresses the IHSS situation. I've always been on the CDASS side as a true participant. So, and I will say it, and Michelle, I'll just speak right up, is that I know that children is going to be an option in the CDASS program here coming up in the future. So that might be a nice option to consider there.
Yeah, I totally
Bobby,
agree.
what were you applying for? More the CDASS or the IHSS version?
I was initially applying for the CDASS co-chair, but I do know a lot about the other program only because I worked with it as an advocate for other clients.
Okay.
Okay. Very nice. And I see we someone else with their hand up. Jay Miller. I see Kelly have your hand raised.
Yeah, thank you so much. This is Julie Miller, Montrose County. I just had a question for Bobby. I was just wondering, Bobby, why are you interested in this position with the PDPPC?
Very simply because I have been feeling personally like for the last year, like we have been fighting to be heard. And I feel like if I can help in that need, and I can bring my skills to give people a voice and myself a voice, that I want to do it.
All right. Any other questions for Bobby?
Renee?
Hello?
Renee?
Hey, Renee, go ahead.
Yeah, Bobby, are you a CDASS or IHSS participant?
I am a CDASS participant.
Okay, thanks a lot.
Okay, and I do see one person with their hand raised. It's just a phone number. I don't know who that is. If you want a question, we'll open right now. If not, I'll just kind of lower your hand, please. I'd appreciate that. All right. Any other questions out there?
I apologize, Kurt. This is Erin. The phone number. Oh, sorry. They lowered their hand. I think we're good. Move along.
Okay, good. All right. There is one more person, and I have to say I am remiss in finding that information. I just got a little bit of a go regarding one more person wanted to apply. So if you applied and I did not mention your name, I'd love it if you could speak up.
Kurt, it was Chelsea Kramer.
Hey, Chelsea. Yeah, that's right, Chelsea. You had forwarded me that information. Chelsea, are you available? Chelsea? And Jessica, I cannot find that email that you forwarded me on that. I thought I saved it in my folder. Do you happen to have that yet regarding Chelsea's qualifications? All right. So, and again, I have no problem with share with everyone. Chelsea, I know she's been around for a while, but you can see here where everyone can see here she's showing interest in being a PDPPC co-chair. She is a member of IHSS services in Colorado. She's in Greeley, where she resides, and has since 2010. She lives in Colorado since 2004 and is now has deceased parents, and she moved here now because of amazing, beautiful Colorado. A big reason is why I am here, next to the opportunity that Colorado has to offer, the opportunity I have to offer Colorado. I've been a member of Colorado First since around 2008, a member of long-term care services and support programs for only about 2 years or less, but she believes I am a valuable asset to HICPUF because of my resourcefulness and skills in finding ways to the best care possible and ensure a healthy and stable environment for myself, those that love, and those of loved ones around me. A discerning, kind patient, and I love to learn and grow as a person, figuring out what types of resources there are available, as well as obtaining and securing them, are something that I'm not only good at, but experienced at. I would love to have the opportunity to policy as well as be in communication and collaboration with others who have great ideas. I want to shape policies as well as in a way that we receive the benefits that are pertinent to our health care and success for independence. But anyway, so does everyone else see what's going on, how she has explained herself here? She has experience in learning and discussions and would love to gain skills and learn more about the types of leadership in the co-chair position would it be offered. And then goes on to say, I hope you would consider me in fulfilling and exceed the expectations of the role. Does anyone have any questions about that right offhand? Unfortunately, she's not here right now, so. And I have to say this, again, I was a little bit remiss in making sure everyone was available. Just what do you guys think it would be if we could just maybe throw this open one more time next meeting before we actually have a vote?
I think if that's what you and Kevin feel is, I personally think if that's what you and Kevin think is best for the process, then, I support that. I definitely would love to hear from the others on PDP as well too.
Right.
So this, Kevin, what I would suggest is, yes, we can take a vote on in the May meeting. We're not going to accept, obviously, any other applicants. What I would say also is, Kurt and I, do we need to read over a bio of our experiences being co-chairs? And then the next thing is, what is the voting going to look like? Are we going to send out a survey, or are we going to do it live? That's a question.
That's a good question. Let's open up to the floor. Would it be better to do it live at the next meeting? Should we do a mailer where you mail it back in? That can be a little bit time consuming. Do we do a survey as far as the votes? Any comments out there on the floor? Let's open it up.
Renee?
Hey, Renee. What's your thoughts, Renee?
I personally prefer a printed ballot.
So an election ballot.
would you like that mailed to you? Would you think that'd be the way to do it with each bio?
I personally, I'm fine with mail. I don't know. Like I guess my question is, would it be a problem to then get them back by the next meeting?
Well, I think we're kind of opening up now with the idea that we could discuss this and then have a vote in the main meeting, if I remember correctly. So I think that's the process. We were hoping to elect someone at that main meeting. We can do it by people attending, or certainly let me just ask her, Danny, would we send that out? I don't remember how we did it last time, if we just had bios that we sent out and then voted on people. And quite truthfully, the last time we had an election, Kevin and I were the only ones who ran, and previous to that, we were kind of voluntold to join quite a few years ago, back when Kevin and I first started it. So things have changed a lot, and certainly we could do an email and or combination of some point.
Yeah, I would suggest that we do both. I mean, we can do an electronic version and when the documents are sent out for the May meeting, the agenda, that we can send out a mailer with a ballot indicating that whether the applicants are requesting become co-chair for IHSS or CDASS or other. Like in Michelle's case, it sounds like she has experience in several arenas, but now the children's. So we need to take that into consideration as well. Jessica, what are your thoughts on being able to do something like that?
So I think that if we're going to get an influx of individuals who prefer a mailed voting ballot and voting documents, we need to have a little bit more time to prepare, just to make sure that those absolutely get to people. I think Renee's comment from earlier is a good example of why we need to really have that process locked in.
Right.
And so I would, and we'd also really want to identify individuals who absolutely want a mailed ballot, despite maybe not being on the snail mail list. So I think some more communication would need to happen between, among stakeholders in this group. And then, of course, there are plenty of people who are not present, who are still actively connected to PDPPC.
Correct.
And want to participate.
Right. So maybe I can suggest tomorrow's planning meeting, we will come up with a plan on sending out bios or requesting bios to get them out. I know I've done some of these virtual connections with other boards I'm on, where they send out a bio and then people have opportunity to vote for those people by internet or by mail. But it is a bit of a process. It tends to take about a month between collecting all that information and getting votes. So I think we got a little bit of work to do to set up a vote, and including, I know I have not submitted a bio yet. I don't think Kevin has as well. Any other comments out there, anyone? We'd really like to kind of figure out how to move forward with this. All right.
All right, well, why don't we go forward with that, Kurt? Tomorrow during our planning meeting, we'll come up with a method on how to accurately capture everybody that's interested in being a co-chair, and then we will send it out, however, to make sure that we take the vote at the next meeting, if possible.
All right.
All right.
Sounds good. Hey, Michelle, I see you have your hand raised.
Yeah, if I could just, and maybe I'm not seeing it, but when I go to the PDPPC website, the last updated information is from the January meeting. So nothing past January as far as recorded meetings, agendas, meeting notes, nothing's been posted. So, and I know that it can take a couple of days, but I just really encourage if we can get that updated on the website so that those that are not here understand if they're getting this random ballot email, what they're doing with it, if they're not in the loop. So if we can get that up to date, that would be helpful for those that aren't here.
I agree.
Aaron, I see you got your hand raised as well.
Hi, and thank you. So this is Erin. Regarding website content, we are going through some changes and some accessibility reviews. So there are changes happening with the PDPPC website right now, but we will make sure that all the documents are updated. I would like to just ask 2 clarifying questions. One, so Kurt and Kevin, are both of you putting your names forward to be considered in this election? That's the first question.
Yes, I am. This is Kevin.
Okay.
I am considering it, yes.
Awesome, thank you. And then is there anyone on the call who would like a mailed copy? I'd like to, we have a snail mail list that we maintain here at the department that we send out mailed versions of the agenda and content we're going to present. If there's anybody on the call who would like a mailed version and may not be on our snail mail list, if you could put your name in the chat or raise your hand or unmute, it would be helpful for us to know how many people we're looking at, because that will make factor into what the options are and how we move forward.
That sounds good.
Sounds good to me.
Renee?
Hey, Renee.
I just wanted to ask, Aaron, do you want me to speak up again for that to receive the mail? I'm not sure.
Well, thank you, Renee. We've got your name down. we know. So is there anybody else though? And thank you very much. We really appreciate hearing when you don't get the mail. We don't like to hear that, but it's helpful to know what happens. And I will just say, we want to be mindful of the return because we're not really in the office so much. We've got a couple staff in there. So I think we've got a couple options to look at, but if there's anybody outside of Renee who would like a mailed ballot, please put your name in the chat, raise your hand or unmute.
Hey, Julie Miller.
Yes, I do not need a mailed ballot, but I did have a quick clarifying question. So are all of these positions for 2 positions, 2 co-chair positions, or has that been decided yet?
I don't think it's really been decided. We've kicked around the thought of having 3 positions, partly with the advent of the CDASS program now being made available for children programs. So that might be a nice option where we have maybe 3 co-chairs. You got to be careful we get too many, then we have too many chiefs running the program here, but I don't think there's really been a decision made.
Okay, will that be communicated out at some point so we know kind of what we're voting for, what positions?
I'm going to say most definitely. I know last time we had it was going to be 1 person, and then Kevin and I both stepped up and we went, hey, this is a great opportunity to have more people involved. So I think that's something we'll have to make sure we consider and discuss here moving forward.
Clarify. Thank you.
Anything else? Anyone else? Okay. All right. Well, we're just a few minutes ahead of schedule, unless anyone has anything they want to jump into one more time regarding that. Please feel free to jump in. And if not, we are at the next step, which is at, what does this say here? Meeting registration, advance in voting. We talked about that. Let's talk about that overspending protocol review. Danny, I know you're in charge of this here.
Kurt, actually, this is Jessica. We didn't discuss the meeting registration and attendance, so we're about 7 minutes
my
behind
apologies.
schedule. That's okay.
Okay.
So
Well,
I'll
let's
take
talk
this one.
about meeting registration and attendance.
Thanks, Kurt. Danny, would you mind pulling up the Zoom registration doc? Perfect. All right. So, hope and apologies again that this didn't get out to those of you who need hard copy documents, but hopefully I can explain it in a good amount of detail so you all will know what to expect. We are going to be switching the PDPPC registration process and the way we capture attendance completely over to Zoom. So currently, many of you might be aware that we use Google Meet, Google Calendar to create an event series for PDPPC. And this has worked to some extent for quite a number of years now, but it's becoming a little bit more problematic as more people don't always use Google and Google Calendar specifically. When we add individuals, it can often update the entire 200 plus people that are on that event series. So moving over to Zoom will just clean up the process and make sure that we can better manage individuals who want to be added to PDPPC, people who want to be removed, and that individuals who are wanting to register for PDPPC have the option to add the event series on the particular calendar that they use, whether it be Outlook or Google Calendar, what have you. The current list of stakeholders that we have, and as I mentioned, we have about over 200, will be sent an invite through Zoom to re-register for PDPPC automatically. So you do not have to worry about reaching out to HCPF to ask for that to happen. And I will be doing that on Monday. If by chance you don't get that email, then you can either access the link to register in the emailed document that is a hyperlink, or give our unit phone number a call and we can help walk you through it. So our unit phone number is 303-866-5638. So Dan, if you'd scroll down a little bit. So this is just a screenshot of what that invite will look like. The description section is exactly what has been in Google Meet for quite some time. So just, more about what is PDPPC, the schedule, calling attention to the fact that November and December we're often holding the meeting on that third Wednesday. All stakeholders are welcome to attend. Pause there, Danny, go up a little bit. Thank you. The meetings themselves, as you know, because we're in one right now, are already hosted by Zoom. So do not worry, there will be no changes to the login information, to the call-in numbers. None of that is changing. And as you can see in that invite, it will list all of the dates for the year, including November and December, that you'll get added to your calendar once you register, if you choose to do so. So that's kind of nice too, getting a sense of those future dates. If you scroll down a little bit more, Danny, thank you so much. The registration section is very simple. You're just putting in your first and last name, your email address. We're collecting the stakeholder category on this registration form, much like you do for the attendance form. And then just one more question about whether or not you're currently connected to PDPPC and whether you'd like to get more information. This is really just to identify very recent individuals or brand new people who happen to get the invite, who aren't quite sure what exactly is PDPPC and might want more information. So then you would click register, and then if you scroll down, Danny, this is the email that you'll get confirming your registration. Again, it lists out all of the dates and times for those sessions. You'll get individual calendar events for those dates, and then reiterating that description of the meeting. Let's continue scrolling. Thanks, Danny. And then, oh, sorry, that last thing I just showed was the confirmation screen online. This is the email. It looks very similar. And right here on the email that will come to your inbox, you'll be able to add it to your calendar, either Yahoo, Google, Outlook. You also have the option later to go back to that email if you save it in your inbox to cancel your registration or to change it if you want to say use a different email address. And this is really great because it means that, again, you're updating your interest in the meeting without everybody else who's on the series getting those notifications that have been going out. So really will clean up the process, as I mentioned. And then again, down below will be the Zoom login details that help to get you in the meeting, either by logging on online or calling in. And again, this hasn't changed. So we really hope that this will be not only just a better way to manage it, make sure that there isn't any confusion about whether the meeting's happening. We know some accidental deletions of the series have happened recently and caused some confusion. But what it also means as it relates to attendance is that we can start using Zoom itself to pull attendance reports and use that as a means to update the voting record. So right now we're doing the Google form. It opens on Monday, it closes after the meeting. And we know that sometimes people can forget to do that, leading to maybe the voting record not being completely accurate. So we are discontinuing the Google attendance form. That's one thing y'all won't have to worry about, remember to do. And after the meeting, we'll have pretty detailed Zoom attendance reports that will include everyone's name, their stakeholder group affiliation, as well as how long that a person is in the meeting. So do they hop on for the beginning, stay 5 minutes and hop off, or do they stay the full, 2 hours? The process to use the attendance records to give to Robin to help with that voting chart will not change at all. So I don't know if Robin is with us. That process will look exactly as it does. And then the voting document that gets sent out will look exactly as it still does. So that's all I have. I'd be happy to answer any questions or explain anything that I went over in a little bit more detail. And again, for those who didn't get the document that I just went through, I'll get that sent out just as soon as we end the meeting. All right, I'm not hearing any questions, Kurt, so I'll turn it back over to you. Thanks so much, everyone.
Okay, I closed a bunch of applications, so hopefully my internet stabilizes a little bit here. My apologies. By CenturyLink, I had the best possible service.
Hi, everybody. I think we might have lost Kurt for a moment. Apologies. Let's see here. Danny, can we flip back over to the agenda? Okay, great. So it looks like you're up. Overspending protocol.
It does look like I'm up. Thank you, Erin. I will also disclose that I've been having some internet connectivity issues today. So I think Kurt's not alone in the CenturyLink shenanigans. If you can't hear me though, or if I drop off, hopefully I can get a ping from HICPUF staff too. Alrighty, so I do want to jump into overspending protocol rule review. As I mentioned last month, we are moving forward with changing our regulations that would permit the state to allow members to spend over the 130% spending limit that is in place for CDASS in the event that there are reserves in place to cover the overage. So we have gone into the regulation and made a couple, it hasn't been finalized. I have a couple of suggested edits that I think will help clarify our regulation language to permit members to spend as they need to. I think as we discussed in the recommendation, this still will require a prior authorization. It's not going to be, you know, complete spending. However, there's still a bit of a prior authorization required. But I will show the language here that we have proposed. Apologies, I'm just having issues with Zoom today. Okay, so in our CDASS regulation, we currently have verbiage that states budget for attendant care within the established monthly and CDASS certification period is part of the member or authorized representative's responsibilities. So that will remain a member authorized representative responsibility. And part of the requirement is that services that exceed the member's monthly allocation by 30% or more are not allowed and cannot be authorized by the member for reimbursement. And the language that I'm adding or hoping to add, suggesting to add, soliciting your feedback about, is if we add the language that says, unless prior approval is obtained from the department or its designee. The designee is just to create some flexibility so that we can work within the overspending protocol to determine who it makes the most sense for that person to be. If it makes the most sense for our case managers to review it, if it makes the most sense for the state to review it, or the FMS or the training vendor. I think these conversations have not even happened yet, but I think just so that we have the flexibility to make the decision that makes the most sense for our programs. So this is the first segment of rule. And because the other suggestions are so similar, I'm going to go ahead and scroll down to that as well. And then I'll open it up for any questions or feedback or comments so that we can take that feedback back. So the second segment that we are proposing to change is in the CDASS attendant reimbursement segment of regulation, where it outlines how attendants can be reimbursed. There's currently a section that states attendant timesheets that exceed the member's monthly CDASS allocation by 30% or more are not allowed and cannot be authorized by the member or AR for reimbursement through the FMS contractor. And again, the suggestion is to add, unless prior approval is obtained from the department or its designee. And again, this language is really intended to create flexibility within the overspending protocol that already exists, so that we have the flexibility to mold that protocol in a way that makes most sense for our program participants. So with that, I do want to open the floor up if anybody has any questions, comments, concerns, or feedback. And I apologize, Jessica or Erin, I had forgotten to ask one of you to do this, but would you mind helping to take notes on the feedback that we received? Thank you. And feel free to raise your hand to come off mute, or if you have any feedback, feel free to put it in the chat. Yeah, Robin, go ahead.
I guess to me it makes sense, just it should be I hate to do this to case managers, but it makes sense. Just the case manager knows the person, knows the circumstances, can see if there's sufficient funding in there, that it should be something, a really short process, like a phone call saying, you know, for me, I'm going to be awake for 3 or 4 days. You know, we're going to have somebody stay at the house for 3 or 4 days. We may go over this month. And yeah, it should be really simple, like a phone call or an email. And I think that it makes sense to do that at the case manager level because they know us. So that's my only comment is let's make this really easy.
I agree. That's my goal as well. And thanks for the feedback, Robin. It's nice to get it. Nicole, I see your hand.
I just wanted to please get clarification. So this would have to be done before timesheets are filled out. It couldn't be approved after they're filled out.
So I think that at this point in the process, we have not been able to develop a new process for how the overspending episodes will occur. So similar to Robin's point, I like the idea and I like the feedback. I think that that feedback is what I specifically want to make sure is incorporated in the edits to the overspending protocol. We just aren't there yet. So because the rule change takes so long to complete, that's where we're starting, is to try to get the rule modified so that we can actually make the programmatic changes, which is why I'm proposing to make a rather vague insertion into our regulation so that it promotes the most flexibility for us to really get in the weeds and figure out the best overspending process for our specific population.
Okay, I just want to make sure that we would still have the flexibility to approve it after, even though it says prior approval.
Okay. Yeah, I think at this point, I believe that our recommendation response stated that prior approval would need to occur, and that if there was not prior approval, then the over expenditure could not occur. But I would need to pull the recommendation up. But I'll make a note of that to evaluate. And I think I saw Patricia next, and then Michelle. So we'll start with Patricia.
I just want to make sure that that the case managers are aware that we are going to contact them if we want to go over it. Because I know I've talked to my case manager and she didn't have any clue about what I was talking about. So that might be a new training thing. That's all I have.
Thanks, Patricia. Yeah, great feedback. I think, again, that communication definitely needs to occur. At this point in the process, this is not an available tool. So overspending in excess of the 130% limit is still prohibited, regardless of if there's prior approval or not. So we haven't made any changes to the policy yet. What we're really trying to do with this rule change is tee it up so that we can at least have the flexibility to change the policy, because right now we don't even have that option. So we're still very, very, very early in this process. And again, Patricia, your feedback is super helpful and will definitely be incorporated in our overspending protocol process changes when we get to that point. Michelle?
So as I've already said, I'm not as familiar with CDASS, so this is a little different for me. So I'm just throwing thoughts out there. When it comes to, I agree with Robin and the others that have said this needs to be hopefully a simple process, a phone call, not a long drawn out authorization. My only concern with putting that on case management is, as we all already know, case management has a lot of things being put on them. And so my concern is, where does the accountability lie? If a AR or a member calls the case manager and says, hey, we've got some changes, we're going to go over this month. Case manager looks in the system and sees, okay, this is within budget, but maybe some things haven't caught up and they end up going over that 30%. who's going to be held accountable? Is that the AR? Is it the case manager? Is it the agency? Is it HICPUF? There just needs to be some checks and balances in place to make sure that, you know, this process is easy for members to access, but that there's accountability there as well.
Thank you, Michelle. I'll definitely take that feedback to when we get to the point of editing or revising the overspending protocol. The overspending protocol is already in place. We have one in place for how spending can occur within CDASS. So if you are interested in learning what is currently allowed, we can get that link for you. I think it's on the CDCO website. But again, I think the process for spending over the 30%, that still needs to be cleared out. We are not there yet. What we're really trying to do right now is just open that door so that we have the freedom to make the edits within the overspending protocol. So right now our rule doesn't permit any spending over the 30%. And so we're just trying to get some edits in place so that we can actually get into the fine tuning of what that looks like, the programmatic and operational changes that are needed. And I'm sorry, I guess I should clarify, I did mention this last month, but I didn't say it today. We're definitely happy and willing to have a work group to discuss what needs to happen to make these changes within the overspending protocol. I definitely don't want to take that on by myself. Last month when we asked, though, this group said that they did not want to do that. So now it sounds like maybe that would be helpful. So when we get closer to that step in the process, I'll reach out to this group. I'm sorry, Erin, I see your hand up. Go ahead.
Thank you, Danny. So going back to, I think, Nicole's comment that about like, can you do it going back in time? I'm thinking about like the IHSS agency perspective here, and I know this isn't really comparable, but I think about like someone who's hospitalized and they get released on like a Saturday and they need more care. And I mean, you're just going to do it. You're going to do it because it's needed and, you know, you'll figure it out. But I'm thinking if there's like a middle ground, because at least on the IHSS side, like we know we can provide the care. And then once case management gets in and the agency RN gets back in, and works with the family to figure out what services look like with the change of condition, that can be a little bit of time. And so I'll just put out there, I think there might be like a middle ground that maybe we can evaluate with our FMS vendors and case managers. So I'm not opposed to a work group, but I think I don't want to see us, I don't know, like missing something that makes it really complicated to get this passed or like, you know, get the approval. So thanks.
Thank you. I still see a couple hands from Robin, Nicole, and Patricia. I don't know if you guys were wanting a second round, but I will address some of the comments in the chat that the case managers are overworked and unresponsive at times. I think it needs to be the AR who approves the overage since they're the ones who approve time and can see the budget. Thank you again. I think for this regulation, it says or its designee. So as we get into the actual development of the overspending protocol, we can evaluate who it makes the most sense to approve. And then Nathan, I see your comment. The AR, if there is one, is always the first point of responsibility for account management. If there is no authorized representative, then the member is the first point of responsibility. Of course, there are always avenues for getting corrections if mistakes are made outside the control of the first point of accountability. Thank you for that. And I can look, I don't know, Jessica, do we have the recommendation readily available? I just maybe want to go over the timeline because I think there might be, I just want to make sure that it's clear that at this point, we are just suggesting the rule change so that we can get that ball rolling while we at the same time are working on making changes to the overspending protocol. And so right now, I really am just wanting to solicit feedback for the specific regulation. And then when we get into making changes to the overspending protocol, I think that's where we're going to have a lot of really in-depth conversation about what makes sense as far as who is accountable for what and whose responsibility and who it makes sense to approve and those sorts of things. I think Nicole's comment about the prior approval is definitely something that we should consider because that specific terminology is outlined in regulation. But right now, our regulation is not detailed enough to get into who the approvers are or aren't or what the specific process is. So I do want to just try to call attention to the regulation specifically. And if it'd be helpful, we can go over the entire process and all the steps involved with implementing this new operational change within the CDASS benefit. And Robin, I see your hand. Is that a second round? If it is, feel free to go off mute. I'm going to take a quick look at the agenda. Looks like we are at 2:20, so we are going over. I want to be very respectful of Amanda Lofgren's time as she is here today to speak about case management eligibility updates. So I just want to make sure Amanda's here, and if so, I think we'll go ahead and end where we are.
Good morning, afternoon.
Thank you. And just to close out this topic, if anybody has any other feedback, please feel free to reach out to the HCPF PDP email inbox, or you can call us at 303-866-5638. And I'm going to kick it over to Amanda so I don't intrude on her time anymore.
Oh, well, thank you so much for letting me join you all today and the invitation to come back after last month. I really appreciated being able to listen to the conversation because I think it's very fitting to why you asked me to come, which is, there's just a lot of things happening right now in the broader long-term services and support ecosystem where we have, a new IT system that was implemented for our case management agencies that is combining multiple systems that they historically had to use into a singular one. In addition to, we are working through the final stages of our federally required components of case management redesign to come into compliance with conflict-free case management. We are in the third phase of those transitions. And the public health emergency unwind. And certainly all three of these happening concurrently has had an impact to you all and your family and your friends and our community that is receiving long-term services and supports, but also our case management agencies, our county partners, and our service providers. And so the department is looking and has been working really hard on, we have 5 areas that we're really tracking closely to make sure that we are able to stabilize the long-term services and supports system. And so just as a reminder, those 5 areas are really looking at inappropriate terminations during the long-term services and supports or long-term care financial eligibility renewal process to make sure that people aren't being denied for procedural reasons, such as missing documentation, paperwork, or level of care. Also a focus on making sure that there's not missing PARs. Our systems that are supposed to be speaking to each other just are not working as intended. And so there are missing PARs that are resulting in members and providers not getting paid. Working through all of the new issues or known issues or change requests that are needed for our care and case management system to be working optimally for our case managers and end users. And then capacity for our case management agencies as well as our county partners to make sure that they're able to do the work. And, if some of them have backlogs, but also preventing backlogs from occurring. and then making sure that we have a process for escalation and appeals that is timely and responsive. So just some updates from the last month meeting is around terminations. In March, the department was able to reinstate a little over 6,000 members. And starting in April, we were able to get the system fix in place so that all LTSS members will be moved into the pending, which will help minimize termination letters from going out. And we should reduce the number of members who are being inappropriately terminated substantially. We also are looking at, while we continue to work through strategies that are looking forward, really making sure that we have a plan and processes in place going back to the prior months for those members who were terminated. And so the department is working closely, our eligibility team and the systems team, to really look at how we can identify those members and get them reinstated and make sure there's not a break or a gap in services. Renewals will also continue to be sent out as appropriate, as this is a yearly federal requirement and not unique of the unwind. However, with some of the additional system fixes and opportunities for an additional 60-day extension to submit paperwork, again, these are the longer term strategies that will hopefully avoid some of the challenges we had prior to February. In terms of making sure that there's PARs, the department has been able to create benefit plans manually through the system in our interchange to make sure that members have a benefit plan in the bridge so that providers can bill against PARs. And when we talk about benefit plans, it really is now with streamlined eligibility in place. It's identifying the waiver in which the member is on in the interchange. And so that automation is not currently available. And so it has to right now be a manual step that the case managers have to take, which is not user-friendly, and it's also very administratively burdensome. And they're getting a lot of errors in the processing of that. So the department is doing that on the back end to alleviate the breaks in service or providers not being able to be paid, and also address the challenges case managers are having. So since March 29th, 7,393 benefit plans have been created, and we've been able to pay out just over $9 million to providers for claims reprocessing. And we'll continue to weekly work through and create those benefit plans for members that are missing them so that we can make sure all providers are getting paid. The other thing that we're doing around PARs is implementing a temporary system update to ease claim payments so that prior authorizations and payments will be addressed. So if you know of a provider out there who said that they've been providing services and they weren't able to bill or didn't believe they could bill, they can go ahead and bill for previously approved PARs. And the department has a system fix that will temporarily reprocess all of those claims. And so that is something that we are also seeing and hearing relief across the provider community being felt. For case management agencies and counties to make sure that they have the capacity and resources they need, we are working on implementing some additional funds that the department received. We received $28 million for the new incoming case management agencies. And then we're working on leveraging ARPA funds for outgoing case management agencies to help alleviate some of the pain points and pressure and additional workload that they're currently experiencing after the phase 2 of the care and case management system. We'll be working with the case management agencies and the counties who have backlogs in certain activities and requirements to develop a backlog reduction plan. And the department will be monitoring those both with data as well as monthly meetings to make sure that we're able to address the backlogs and really reestablish the ability to provide timely services across the state. We did some on-sites with our system vendor with the agencies, the case management agencies that have backlogs, to really understand how the system is driving the challenges in their day-to-day workflow, to prioritize some of the fixes that are going to be released going forward every 2 weeks. So every 2 weeks, the department's IT vendor that oversees the CCM will be releasing solutions to the known issues or the change requests to make the user experience improved. Our counties also are working through their requirements to provide ADA accommodations to include all publicly available civil rights plans that detail auxiliary aids and services they provide. And so our county team is working really closely with them to ensure they have that. And also for the counties that have backlogs for their LTSS renewal applications and processes, they're working with them on their reduction plans as well. And then the last update, because I know I just had a few minutes to join you this afternoon, which I appreciate all of your time, is really around the appeals and escalations backlog, and making sure that we identified and were able to bring in some additional staff at the department to support appeals and the backlog, to make sure that there's quick response times, as well as getting those addressed and resolved now that some of these new solutions have been implemented. We also are creating a Spanish version of our escalation form and have identified and hired staff that are bilingual and able to support our Spanish-speaking families and individuals receiving services. So that is an update from where we were at last month. Happy to take questions, or if I don't know them, to take them back to the team and bring them back to you. I see 2 hands up. Let's see, I think someone on the phone was first, but I don't know your name. All right. Michelle?
Hi, Amanda. I just had a quick question. You addressed working through the appeal process. And I just have a question, because we have families with IHSS that there's procedural issues, you know, one system not talking to the other, that's causing the PAR denial. And then in response to that, appeals are being filed, but appeals are being filed against the county. So we have this like fatal attraction thing going on. The counties are saying, hey, we're not responsible. It's a bridge CCM issue. Is there something that the families can do or providers can do if they're not getting paid, or there is still a PAR denial besides appealing? Is there, and besides, I mean, the escalation form doesn't always get a quick response either. What are your suggestions for that?
Yeah, so the appeals team is working on, now that we have the list of members that were reinstated for financial eligibility, as well as those individuals who had the benefit plan created, are working to make sure that they're connecting and coordinating, so that if a member has been reinstated and it is a system issue, that they're informing them that they do not need to, that everything has been reinstated and the appeal is no longer needed. Some people are still choosing to continue with that, but I would say my recommendation is to use it. So for those instances, if they haven't heard anything, or a provider is saying they're still not able to get paid, sending into that escalation is my recommendation, because that is then where the tracker and then the triage to the appropriate teams. We have brought on 6 additional staff to help with escalations that are short-term temporary staff. And so we're starting to see a turnaround time and resolution on the escalations improve pretty substantial. So they're able to do that cross-check. So that's, Michelle, for the least the interims period is the best course of action there.
Cool. I see we have Robin and Tracy. I'm back, everyone. Let's see how long that lasts.
I can go. This is Tracy at the Independent Center, IHSS agency. So when you say we can bill on an old PAR number, we did try this when that direction first came out, and then the billing was denied. We only did it with 2 visits because we were kind of afraid, I'll be honest.
That's fair.
of what might happen. So how is there a workflow for that? Are there directions that can be sent out on how to do that?
Yeah, so I have to track it down. We did send out a workflow, like here's the steps to take. So let me find that and then we can share it out. I would say though, like there are some anomalies, right? In sort of the system workflows. But so if you could send those claims into us so that we can actually look in the back end and see what's going on, if it's just those 2 claims or if it's maybe something that's leading to that in the workflow, like you said, that gives us the ability to do sort of that retrospective root cause analysis and to get it resolved for you. Because you should be able to push those through. So I think that's important for us to understand the why and then help you so other ones that you have pending can get paid.
Right. And then our big concern was once we get an active correct PAR with a new PAR number, are we going to have to do anything with those after?
You're not supposed to have to do anything with those other than just your regular billing.
Okay, thank you.
Yeah, I will track down that provider communication though that outlines those steps, and then I'll drop the escalation form here in the chat for you all as well.
Great, thank you. I think we had one other hand, which was a phone number ending in 764. Feel free to unmute so that you can ask your question. Thank you. Okay, this is Erin. I'm not sure if Kurt is still with us or not. However, just a time check, we're at 2:40. We're a little bit over our scheduled break time. So if there are other questions for Amanda, please raise your hand or put your name or chat or unmute. Okay, not seeing anybody yet. Outside of the one phone number, the person who they may not be here, they may have stepped away for a moment because it's break time technically. We will connect with you and hopefully get the question to Amanda and get a response. And in the meantime, Amanda, thank you so much for being here and just giving us a tiny snapshot into all the work that's happening in case management and eligibility land. We very much appreciate all of the updates.
Thanks for having me, and I'm happy to come anytime.
Okay, great. Thank you all. All right, this is Erin. We're going to go ahead and head to our break. We will come back at 2:50 p.m., which will immediately go into breakout room. So we will see you back here shortly.
All right, everyone, we are at 2:50 now, so we're going to start coming back. I want to make sure we are giving everybody who wants to participate in the breakout rooms the full amount of time, and we have extended them 5 additional minutes today, so we are going to go to 3:20. Opening up the rooms now. Do be sure to look at your menu for the breakout room icon if you're joining us online, and then if you're connected by phone, just hang back and we'll get you into the room that you request to go in.
Are the breakout rooms going?
They
Nothing yet.
are.
Are they? Oh, wait.
Yes, we have started that. Does anybody need help getting into a room? I'm happy to get anyone over if they're not able to access the.
I'm on a telephone, so I'm unsure how to get in a breakout.
Okay, what room would you like to be in? There's the Members Families Advocates room, or IHSS subcommittee, or the FMS and training room.
Advocates.
Okay, I will get you there. Is anyone else needing assistance right now?
Yeah.
AM, I see you now. Okay, you need to go to members, get you there.
Yep. Members.
Okay. And is that phone number 762 tied to you as well?
I'm still not in the breakout room.
Hi, everyone. It looks like we may have lost Kurt in the transition out of the breakout rooms. So I think we can get into the breakout room report outs. Kevin, are you with us? Doesn't seem so. Anyone from the IHSS subcommittee?
Yeah, I can take that. It's Erin. So we had some good dialogue about eligibility stuff, kind of continuing on the Amanda Lofgren presentation about what's happening with eligibility in PARS. Had some good questions. I will just reiterate that there is an escalation form. We will put the link in the chat. So if there are issues that come up with eligibility or a specific case, we really need that escalation form completed. We heard from a couple of different agencies about their specific questions. And one note for Consumer Direct, a request to get future IHSS trainings on the calendar after June, if that can be done. Thank you.
Thanks, Erin. Putting that form in the chat again for y'all. And in our FMS training and case management breakout, we didn't have any real dialogue. It was a small group. So really just a reminder to everybody that that room is not meant to be only for FMS staff, training staff, case managers, but for anybody who has questions related to those three areas or wants some more dedicated time with them and the department. So it looks like we're moving on to utilization review and utilization management report.
Thank you, Jessica. This is Danny. I'll be doing that report out. Sorry, trying to get my video back on. Okay, so we are doing the quarterly report out for utilization review, utilization management, and I apologize, give me just a moment to get my screen up and ready so everybody can see the slides. I think there are some earlier comments that not everybody received the slide deck in the mail, so I will make sure that this gets to you as well. And see where's the screen share option. All right. Just want to confirm that everybody can see the screen okay. Okay. Alrighty. So April 2024, we have been doing utilization management with Telegen for coming up on what, 4 years now. So this has been a long time in the going. I'm excited to share that there's not a whole lot of changes. Everything's been pretty consistent, but we'll just go ahead and dig into it. I'll open the floor up for questions at the end when we get there. Alrighty, so just the past quarter in review, we're looking at the months of January through March of 2024. So over the course of these 3 months, we had approximately 2,955 reviews completed by Telegen. On this slide, you can see the breakdown of how those reviews were completed. As we would expect, the majority of reviews were IHSS reviews, and then we had a good amount of CDASS as well. The reviews that are included in this do include our rapid reviews for IHSS and CDASS, our express reviews, which are administrative approvals and not necessarily the whole gamut of a review, and then our overcost containment reviews, as those do overlap with CDASS and IHSS quite a bit. Just for anybody that's new here or not familiar with the Telegen review process, I just want to do a quick overview of the different outcome types, as that's what we'll be digging into as we get into the next slide. So the first review type you'll probably see is approvals, and this just means that all services that were requested in the initial submission to Telegen were adequately justified and the case is approved without any alterations to the service plan. So this means the case was submitted and then everything was approved. The next review type you'll see, or the next outcome type you will see, is a partial denial. Partial denial occurs when some adjustments to the case were required. It doesn't always mean that the services themselves were denied, though. In some instances, a partial denial is issued if the service procedure code is entered in the system incorrectly, or if the case manager requests the incorrect number of units, because units don't always correlate to the amount of time requested. So partial denials are fairly common. It doesn't always mean that services weren't approved. And sometimes a case manager could be requesting health maintenance activities, which are more skilled services, when maybe they were more appropriate as personal care services. So in those instances, a partial denial might also ensue. We then have our technical denial as an outcome type, and a technical denial occurs if Telegen requests additional information from a case manager after the case has been submitted and reviewed, and then they don't receive the information they requested within 10 business days. So if that happens, the case essentially lapses, or I would consider it maybe an abandoned case. And if a technical denial occurs, the case managers can choose to reopen the case and submit additional information at a later time. But if the case technically denies, it does get captured in this data, regardless of if it was reopened at a later date. And then finally, we have our denials. This is the very small subset of services where, of reviews, where denial, when the entire case is denied. So these denials are very rare, and they usually only occur if the case was submitted incorrectly or if there is nothing for Telegen to review. Sometimes we'll see cases get submitted to Telegen, and then Telegen realizes that there's nothing that they even need to review, so they will deny the case. And we'll get into the data here in the next slide. Alrighty, and I do apologize, I don't have access to the chat, so Erin and Jessica, you might need to jump in if I'm missing something. Okay. So looking at our combined outcome reviews, we'll first look at our outright approvals, which is the approvals without any requested changes. And cumulatively for this quarter, we're sitting at around 73.92% of cases were outright approved. If you've been with us for a while, you'll know that normally that benchmark is above the 75% threshold. So we are slightly lower with outright approvals this month. I think that part of that could be a result of some of the changes that we've had going on within case management and learning curves, because then you'll see the partial denials. Those are still pretty high. We're sitting cumulatively around that 12.28% of cases that required adjustments. So it's indicative that services are still getting approved. We might have just had some clarification errors or small things this quarter. If we want to move into the technical denial section, we are sitting at about 6.48% of all cases submitted this quarter that were technically denied. The final month of the quarter is a little bit higher. Again, we had some case management agency transitions occurring at the end of February and into March. And so I think it's reasonable to assume that some of those technical denials might be because the case started with one agency and didn't get completely wrapped up before moving to a new agency. That doesn't mean that the new agency didn't pick it up or continue. It just means that the original submission, so to speak, was technically denied. And then finally, we'll look at our outright denials. Let's see, we're looking at about 4.75 cases for the entire quarter that were outright denied. This percentage is actually a little bit lower than previous months, where we're normally sitting in the mid 5% threshold. I think it's important to note that the numbers in this slide are indicative of the number of reviews that were submitted, but not necessarily the number of members who received a review. There are instances where a certain member may have had multiple reviews, sometimes even duplicate reviews. Administrative or system things happen occasionally where things are submitted duplicatively. I also want to ensure that we consider that these reviews are only for health maintenance activities. So if services were denied or partially denied, it doesn't necessarily mean that the member didn't receive services. It just means that the requested services might not have met the criteria for skilled care, and those needs were likely met in another area, such as personal care or maybe adult day if they were interested in things like that. Alrighty, so I will move us to the next slide. Just as a quick update as what's happening in the world of utilization review, utilization management. We actually don't have a lot of really big things happening right now as specific to Telegen, but I do want to call attention to the new case management redesign home and community-based services regulations that were made effective in March. The health maintenance activity rules were moved from section 8.500 to a new section 8.7500 or 7,500. If you all have been here for a while, you might recall us bringing those rule changes to the group here, and we had many other meetings about those rule changes. So those are now in effect and available for access. And looks like I forgot to update my slide, but the next URUM report out will be in June. And I would like to pause and take any questions if anybody has them at this point. Robin, I see your hand. Go ahead.
Here we go. Yeah, I have to tell you, like for the first time ever, my husband's approval went through smoothly, like yesterday. So yay, Telegen, for listening.
Yay.
But I guess the question I have is on the partial denials versus approval. Where does the piece where we get tortured with 100 not very bright questions fall? Is that it? It's not really it eventually gets approved, but we spend days answering inane questions that if somebody had read the file, they would have had the answer to. So where do we not capture that information of, like, you know, how long? I guess I want to know, how long did it take and how many back and forths happened?
Yeah,
And I
so
don't know where it lies.
that information is kind of captured. We do track the number, what you're talking about are requests for information, or we call them RFIs.
Right.
And we capture the number of RFIs that were sent, as well as the reasons for sending them. They're tied to each specific case. And so when we've tried to get data that shows a big picture of what's happening with RFIs, it's very difficult to interpret and translate to the big picture, as the reasons the RFIs are happening are very specific to the to each individual case that occurs. So it would require a pretty manual process of going through each case to get some patterns. I think that we could explore looking at a high level some of the trends that we see. Like I think it would be pretty reasonable for me to be able to pull like the top 5 reasons that RFIs are sent and the frequency of RFIs. I will say that they're fairly common, and I want to maybe frame this in a way just to give perspective, I think, for all people. But I think that the reason RFIs are common is because Telegen is trying to get an understanding of each individual as the individual that they are, with only the information that they're provided. So sometimes they're not provided the full picture, and so they do ask questions. And I think that sometimes maybe things just don't get communicated as smoothly as would be beneficial for the members.
Yeah, I mean, what I'm hearing, and you just saw one in the chat, where it goes back and forth so often, and then there's 10 days, and then there's 10 more days, that you go past the renewal date. And I've seen it happen multiple times. And a lot of times it's information that's already in the file. You know, supposedly Telegen has information from last year and, you know, the last 4 years, and they don't go in the file. It feels like for folks with more complex needs, it feels like retaliation, honestly. That's what it feels like. So to ask somebody on a ventilator if they're still on a ventilator when they have a degenerative fatal disease, you know, those kinds of things. It's like, it feels very much like retaliation for having a high, you know, a high level of care. So that, and it also goes back to that whole issue of why does this take so long?
Sure. I appreciate your insight. And first of all, I empathize with the time that it takes to get reviews completed. Sometimes I can imagine how stressful that process is. And Robin, I know that you and I have talked offline about this plenty of times, and I hear you. I hear what you're saying. And I think that there's a lot of room for improvement within URUM. I think that that's very clear. I think that while Telegen, and I'm not going to say I think that, I know that while Telegen has access to past year reviews, they do not always use them when completing the new review. And the reason is this: Telegen is not the case manager, and they're not the ones that are meeting with the members on a individual regular basis. And so Telegen really relies on the expertise of the case manager to determine if the information that was submitted the previous year is still true and accurate. And so we really encourage case managers to submit the same information if nothing has changed. And if it has changed, we ask them to amend that. the way that we've been trying to meet in the middle, so to speak, for our individuals with highly complex needs who have needs that don't necessarily change year after year is by doing the express review process, which is really an administrative approval where the case manager sends a thing that says, hey, nothing's changed. Intelligence says, okay, great. And they approve it. And that's that. Again, I think we all can acknowledge that this system is not working. And I think as well as it should, I'll say. And it's high on our radar, and we're working really hard to find a better way to assess, utilization needs and have skilled people actually complete these assessments, because I think that it's a really difficult process for members and it's very, very unfair. I hear what you're saying. It's unfair to case managers who don't have the skilled expertise necessarily to be able to justify cases to members. And it's difficult for Telegen, who doesn't have direct access to members, to be able to complete these reviews. As you know, because you've been in the state system for a long time, Robin, you've been around the block. Change takes time, but it is high on our priority list, and it is very much on our radar. And I'm excited for some of the things that we have coming. And I'm hoping that we can get some updates out to the group about what we have in store soon.
Oh, good, good. So does the word support broker come into play?
Oh, Robin. I think that's similar but different.
Okay.
But yeah, we have lots of big change happening in self-direction land, just generally speaking. So
okay, good. Thanks.
Hear you, and we're getting there, hopefully. Any other questions or concerns? I don't want to take up too much time either. AM, I see your comments in the chat, and thanks for that feedback as well. I'm going to stop sharing my screen then, and I'm going to get us back to the agenda, because I think we are about ready to get into the next open forum. Kurt, are you back?
I think we don't have Kurt or Kevin with us right now. Still.
Cool. Flying solo, it sounds like then. Alrighty, well, I guess if there's no other breakout room report outs, we can get into the next open forum. Is there anybody that would like to start the queue? All right, Oliver, I have your name for the queue. Do we have anyone else? All right, Oliver, you want to kick it away?
Yeah, thank you, Danielle. This is Oliver. I have a comment and a question. So the Direct Care Careers website that helps agencies and caregivers find each other. I don't need to remind everybody how hard it is to find caregivers right now. So I think this website is a good potential solution. I know there was, a lot of ARPA money spent on it. My question and concern and comment is, it's not open up. I believe it's available for IHSS people. It's not available for CDASS people. And so I feel like this, and I've brought this question up several times, and I've never gotten a good answer. My worries are that it's just going to get swept under the rug, and we're never going to be able to take advantage of that resource. And so my question is, are there any plans to allow CDASS participants to use that Direct Care Careers website? And if there are plans of doing that, what would that timeline be?
I can jump in to help answer this a little bit, though I do see we have someone from HCPUF's workforce team, so I don't want to overstep. If Justin, you can provide clarity about this. That's a great question, Oliver. And as far as I understand, the plan is to include CDASS So the website is available to CDASS attendants very soon. I think Heather made an announcement last month, and I can't honestly remember what month she said that change was going to occur, but it was in the near future.
Yeah, I asked her and she said she never set a date, and she said hopefully there would be a date, but I've never gotten any clarification. And I'm not talking about CDASS attendants. I'm talking about CDASS employers having access to that site.
Gotcha.
Jessica, this is Brooke. I'm checking with Heather and John right now in the chat, just to see if we have an update on the timeline. It sounds like we might have somebody that can jump on to talk through here in a minute. If we can just maybe give us just a second to get John on board.
Nice. Yeah, I'm pretty far removed from that project, so I don't have a whole lot of the answers that you're looking for.
Thanks. And sorry, Justin, not to call you out. I didn't see that, Brooke, you were with us.
Oh, it's cool. Yeah, no, it's just I don't want to give the wrong information, and
We've actually got like the whole most of the workforce team. Just not the one with GCC stuff.
All right. Yeah. Well, Oliver, let's give it a couple minutes to see if we can be joined by that other staff person. But maybe in the meantime, are there any other individuals who want to make an open forum announcement or ask a question?
And I do see that John has joined us as well. And so if I may, Oliver, just make sure that I'm capturing this correctly. We're just kind of looking, John, for a little bit of information on timeline and maybe the process to get interested CDASS folks in touch with you all to make sure that they're on some kind of list or alerted when CDASS is able, as employers, to join that DCC website.
Yeah, for sure. I'm actually working with Jessica to get that CDASS report of all the folks that are on there right now. And so, Oliver, we're looking at May, hopefully, to do kind of a slow rollout. We're going to hopefully the next PDPPC meeting that we're going to have, we'll just do a presentation. We're actually waiting to get this stuff loaded into the Direct Care Careers website to start doing our testing on that. And so once we do that, we at the next PDPPC meeting, hopefully, if not the next one, the one after, we're going to ask folks to who are interested in kind of beta testing out that side of the website to send us to fill out a form, and we'll get in contact with you and get you logged in to kind of go in there and make sure that everything that you're seeing on the site works for you all. So what we were going to do, and everyone, excuse me, let me step back. Since these are CDASS members, everyone will have a unique ID, so it's not going to have your name on there. So to anyone who is seeing this as a potential worker for you, so that will be all anonymous, and we are actually working on a system to make sure that that CDASS folks will only be put onto the site if they want to. So we're not going to do a huge load and have you all on here if you're not willing or wanting to be on there. So we're going to go over this in more detail in future PDPPC meeting. But right now, tentatively, we're looking at May, June, just to get that first beta testing going and get like the first folks on there, just to give us some feedback on it before we go live.
Awesome. Thanks, John. Greatly appreciated.
You're very welcome.
All right, Danny, do we want to, any last call for any open forum to comments or questions? Let's check the chat. Not seeing anything. Well, I think we can call it closed for today. I'll just close this out because I'm already talking. Thanks everybody, as always, for joining us. We'll pick up in May. Again, reminder, new registration approach coming. So take a look for the Zoom invitation in your inboxes. Reach out to our PDP phone number if you've got questions about that or anything else. And that's an easier method to contact us. Hope you have a good rest of your day.